As more patients are losing fewer teeth throughout their lifetime, the desire to have a more natural-looking aesthetic smile has become one of the most powerful incentives for a dental visit. The Digital Smile Design app tool gives an opportunity to any dentist to reshape the way they approach their patients using visual communication and in learning new ways to deliver the smile their patients desire with the help of their artificial intelligence in a user-friendly and simple way. So let me show you what this small tool can make a big difference in your practice. So once you go to the GST app on your iPhone, go to the menu, which is on the top left corner, and I want you to also try the same patient using your own iPhone. So go to New Case, Smile Simulation, and then go to the box where it says Full Smile. From here, you will select the Try Me version, so you can choose one of these patients. I'm going to select patient number 3, for example. I will place my smile frame onto the patient's face, set the right curvature to it, tap on Next. The artificial intelligence of the DST app will give me a suggestive smile based on the patient's average age and facial shape. If I like my smile, I can tap before and after, or if I want to change to another suggestive smile design based on the artificial intelligence, I can tap on the Generate button. I tap before and after, and the app will generate a before and after slider. For you to have this before and after, just slide your finger to the right and to the left. And based on the smile design that was created with the artificial intelligence of DST app, you can initiate your conversation with your patient. You can motivate your patient in wanting to know more about this potential treatment plan. When allowing yourself to treatment plan your patients with the final aesthetic result in mind, you not only deliver more assertive, natural, harmonic smiles, but also excite and educate your patients and dental technicians on what you are envisioning for your patient's treatment plan to then work it backward to achieve your final goal. In this series, I will show you how to use a modern approach based on the principles of smile design and dental technology to initiate a treatment plan using DST app as an essential tool on your workflow. I want to talk to you about a different approach when initiating a treatment plan. That's why we call it the facially driven treatment plan. When we use a modern approach with DST app, we train your eyes as you are designing your smiles to first understand the final aesthetic result and then work it backward to achieve your goal. Why? Because we want to make sure that you deliver harmony in the smiles that you design. So let me tell you 5 pillars to consider when initiating a treatment plan with the final aesthetic result in mind. After conducting the anamnesis exam, you start your motivational smile simulation with the goal of engaging the patient in the conversation of a smile makeover. What we recommend is for you to do it during the first appointment, and all it takes is a frontal facial picture of your patient to start creating a smile design. This motivational smile design should take about 1 to 2 minutes to create while the patient is still chairside. Oftentimes, we compare it to a sketch. It is an easy and effective way to learn about your patient's likes and dislikes, pay attention to their wishes and current pain points. The visual outcome of the motivational smile design is presented using the before and after tool in the app to demonstrate the difference in the facial aesthetics. It's an easy and very exciting moment for the patient. With a clear vision of what your patient and you visually discussed, these points should be taken into consideration from your clinical and complementary exams. During the extraoral examination, it's important to examine the patient's facial structures, the smile line, and its joints. Analyze factors such as muscle changes, nose, and irregular jaw movements. In the intraoral examination, factors such as the centric occlusion of the patient, overbite, laterality and protrusion guides, buccal corridor, the position of the current dental midline and teeth in the arch, the quality of the gingival health, and other essential notes should also be evaluation. Complementary diagnostic service such as a full mouth series and upper and lower intraoral scans allows you to produce an accurate image that contributes to the restorations. And a CBCT, utilized for evaluation of biotype of measuring hard and soft tissues, thickness and height, as well as bone structures, are also highly recommended to determine what the best treatment option is for your patient. Now, with the complete information, you can confirm or adjust the design for better accuracy using your diagnostics from the examinations and the patient's facial and dental structures to create natural oral-facial harmony. Moreover, it allows you to better explain the treatment options to your patient. When you combine these analyses with GST app, you truly begin to use the app to its maximum potential because you're not only increasing the likelihood of predictable aesthetic results, but you are also allowing yourself to be more dynamic in terms of involve aesthetics, function, and stability based on the facially driven design and on your clinical, digital, multidisciplinary reverse approach. Imagine giving your dental technicians all the information that you want, and in addition to it, share a PDF file of this Maya design with the new teeth selected digitally and place it over the patient's mouth. It will definitely increase the accuracy of your structures so as to enhance the final outcome.